Great. Hello, everyone. Pursuant to Chapter 2 of the Acts of 2023, this public meeting will be conducted via remote participation. Oh, there's Joy right now. A recording of this meeting will be made available along with the minutes on our website, somervillema.gov/biosafety. I just want to thank everyone for coming together tonight just to discuss a couple of items that we've had on the docket for a little bit, but wanted to wait a little bit longer to make sure we could discuss them all at once. So we have a little bit to do, so we're going to dive right in. I'm going to go ahead and conduct the roll call for committee members, starting with Alex Vera.
Here.
Francine Rogers.
Here.
Michael Swickus.
Here.
Tim Bakey.
Present.
Karen Carroll. Elise Ballarge. Rachel Nadkarni. Colin Ziegler here. All right, let's dive right in. I'd like to move to our first item, which is the presentation from ADA Forsyth and their project over at 100 Chestnut Street. Do I have a second? Perfect.
Second.
Love it. Great. So we have two representatives this evening from ADA. Debbie Ryder, the IBC administrator, who's feeling a little under the weather. So thanks for joining us, Debbie, regardless. And Kathy Eklund, the senior director of occupational health and safety, to present on this application of their BL1 through 2 operations at 100 Chestnut. Again, at the conclusion of the presentation, the committee members will pose questions, comments, or concerns. After that, we'll open it up to the public for questions they have. If the public has questions, please enter them into the chat just so we can keep track and then give people the opportunity in the correct order. Thanks again, Kathy and Debbie. The floor is yours. I'm going to go ahead and make you presenters.
Okay.
And you should be able to share your screen.
All right.
There you go.
I'm going to share my screen to begin with, and I'm going to apologize. I put some upgrades into my Microsoft, and my PowerPoint crashed about 45 minutes before the meeting, so I will either redo it if I can't retrieve it, and I will upload it so it will be part of the system. So I'm Kathy Eklund. I've been at Forsyth since 1984, so I go back a long ways. I wanted to, for those of you who aren't familiar with Forsyth has been around since about 1918, and have been in 3 locations: at 140 the Fenway in Boston, next to the Museum of Fine Arts. And then in 2010, we moved our institution to Cambridge, and we are currently in the process of moving to 100 Chestnut Street in Somerville. We've held biosafety permits and licenses from Boston, Cambridge, and hopefully from Somerville. But we do a bit of a variety of things, even though we're a very small institution. At any one given time, we have about 150 staff members, and that includes full-time, part-time individuals. And we have a number of postdoctoral programs as well. In terms of our overall mission, we're really, and from the very beginning, when the founders, the Forsyth family, founded Forsyth, it had a threefold mission of education, service, and research. And in the beginning, Forsyth actually had a school for dental hygiene, which some of you may or may not be familiar with. It's now at Mass College of Pharmacy and Health Sciences. Research, and from its inception, was conducting oral and craniofacial research, dental research at that time, as you would think about it, in terms of dental decay prevention. And for a number of years, tonsils were actually removed at Forsyth. It had a large oral surgery program. Over the years, the research program progressed, our service program progressed, but we have continued to advance oral health, both locally as well as globally, doing things from basic science to basic translational research. And the values we really hold are innovation, as well as leadership and a commitment to community. So in terms of what we actually do, we do research, But we also have what we call sort of basic science research, clinical and translational research, and then foundational technologies and developments. We really look at the outreach aspect of this, and some of you may or may not be familiar with the Forsyth Kids program. It's an outreach program providing preventive oral health services to children primarily in early learning centers, elementary schools, and up through high schools, and we're in about 71 different schools. And then we also do summer programs for high school students promoting science. So we really have a wide variety of activities. I'm going to stop sharing my screen and basically talk through the rest of this. Let me find the stop share. There we go. Our biosafety committee, and I'll let Debbie talk about the number of open protocols that we have, meets on not a we have a schedule, but we don't necessarily have protocols to review. So we meet approximately 3 to 4 times a year, and our membership consists of both internal scientists as well as community members. And then we also will reach out for expertise to outside scientists. And we've had relationships for many years with Harvard, for instance, if we have a protocol that's presented of which we need extended expertise for review. Debbie, would you like to comment on the number of protocols that we currently?
So presently we have 10 open protocols that are, I'd say 9 of them are BSL2s and 1 is a BSL1. And their protocol, their approval period is until like 2027 type of thing. So, and they're, and then we also will review any amendments that come through, which are maybe a few. We get a few amendments a year. Sometimes they're minor, just like a change in the PI, that type of thing. So minor type of amendments usually.
And we also, in terms of processes, we have an animal facility. So sometimes a protocol will come to the IACUC, and then IACUC will refer the principal investigator over to IBC for approval. But any laboratory test and any laboratory work, animal work, all would require review by IBC if it falls within the NIH guidelines for review. In terms of questions, I don't know if anyone would have specific questions or would like to know a little bit more about the depth of our research, primarily in microbiology. The oral microbiota is an area of high expertise that we have with our scientists. And we're about 80% NIH funded across a number of years. So we do, and we're a 501c3 not-for-profit institution.
Actually, Kathy, oh, sorry, Debbie, go ahead.
I was just going to add, and we are registered with NIH.
Okay.
We have a registration.
Perfect. I guess, Kathy and Debbie, if you wouldn't mind diving in a little bit about what sort of operations will be at 100 Chestnut, what sort of work will being done. You don't have to get too specific, but just a general idea of what will be going on there.
Well, as I said, we have, in terms of the scientific work that's conducted, we do microbiology, immunology. We have folks who are working with bone and mineralization and doing bench work as well as animal work. Our vivarium, the primary species is mice, and our IACUC obviously is an accredited IACUC as well. And then in terms of our over processes, in moving to 100 Chestnut Street, it's given us an opportunity to really look at process and flow in general for biosafety. We work with Triumvirate is our hazardous waste manager, and we'll be handling all of our biohazardous waste, both sharp and non-sharp, and all of our hazardous chemicals. And we do, in terms of training of personnel, all personnel who come to Forsyth, regardless of their capacity, if they're a visiting scientist or if they happen to be a postdoctoral student, if they're full or part-time, have to complete our what's called new personnel safety training. And then for those who are working with hazardous materials, there's an extension of that for them. And then we have a number of trainings that are required through City CITI, and that is an organization that's provided online training that we've subscribed to for many years. So depending upon the work that they're doing, the type of exposures that they have, and the scope of what's going on, they'll have a number of required trainings, and most of those have to be renewed every 3 years, and Debbie manages the city training programs.
Great. I'm going to go ahead and open it up to other committee members to ask questions. Francine, go ahead.
So you mentioned you have operations right now in Cambridge. Are the operations that you have in Cambridge moving to
Yes.
Somerville? So it will be kind of a
Yeah, we are just, we're a
facility.
one site facility. We're just in the process of moving. So we still have two PIs at 245 First Street and the Vivarium, and our faculty practice dental clinic is still there. The move plan for this next phase to bring everybody else over is late April.
And Triumvirate is assisting with
Chemical
move,
biohazard management, and they'll be doing, routine and regular pickups for all our bio waste as well as our chemical hazardous waste.
will they be transporting essentially, you mentioned that you are using oral pathogens, so, or at least stuff that's in the oral cavity.
All the biologic materials as well as the chemicals, regulated chemicals, they're all moved by Triumvirate. You have to do that under a licensed hauler.
Yes, I'm aware. I was just curious if you're keeping them in the freezers, you're going to have a permit to do it that way, or you're going to actually pack them and then get your -80s up and running potentially if you're using
Well, they were moved in the -80 freezers. It was 1.1 miles from 245 to 100 Chestnut. And so Walsh Movers moved those. Everything was sealed, locked, wrapped. And then everybody was following. They were both on site for the move at 245, and then everybody went to 100, and they were plugged in and ready to go immediately. And then everything that was in -20s and were actually put into cold storage and not moved in -20s.
Thank you.
I see Michael.
Thank you both for this presentation and all the materials that you sent before. You're in the middle of the move, and there's a bunch of site-specific training that's referenced in the materials that you sent. What's the status of that training? Has that been done? Is that underway?
Well, no, we're right now. We had a staff council meeting yesterday, and I introduced everybody to some of the new facilities, emergency evacuation, our biosafety management, and the laboratories. And then we're doing a major recorded training and live training for all personnel. And then that will be continued when we have new people who come in. That's part of the new personnel safety training as well. So yes, and then obviously if anybody's due for any updated city trainings, they have to complete those. And the IBC requires all the biosafety training, and that everyone is up to date with that, as well as the training that I do and providing that documentation.
And so what you say you're doing? What's the status of that? When is that planned? That the big live training to initiate everybody to the new building?
Right, right. And that's what we're planning now. When everybody's in the building, we're doing mini pieces right now with individual labs as they're there, so everyone knows where everything is, including the
Great.
eye wash station, safety shower, etc.
So everything looks great on paper. Do you have any problems with compliance from PIs or anyone, any other laboratory personnel?
Well, not serious compliance, but like everything else, reminding people to wear their eyewear and, the basic stuff. And you're at the bench and where's your lab coat? That kind of thing. And that's sort of true for everybody. So it's those continual reminders. And
Is it a
then
single BSL2 space or are there multiple BSL2
it's
spaces?
basically the way the labs are built out, it's like a very large horseshoe on the outer parameter, and those are all laboratories that are relatively open in the sense that you can walk through them. And then the PIs have a certain number of benches that they work with, and they're organized by the group, such as immunization, oral biology, mineralization, in their individual groups.
Great. And two more. One, do you have any concerns about the trains behind or the community path? Has there been any thinking about whether there'll be any impact on your operations or vice versa, impact on the community path?
Um, I don't believe so. I mean, we were obviously concerned about security in general,
Right.
as well as transportation. And we could have a lot of our folks actually take the T and take bus routes to and from work. But in terms of overall concerns, the building has many security measures in place. And obviously, everything is card coded, both for the building as well as a secondary for entrance into our floor on the fourth floor.
I mean, you have animals on site. Is there any history of protests or bomb threats or
No,
anything else like that?
no, I have to say we've been very fortunate, and I've been a member on the animal committee since the 1990s, and we have not had any issues at all. And, I think some of it is that many people just really didn't know what Forsyth is or what it
Fair
does. It's
enough.
like, what is Forsyth? So
All right.
I think,
And the last question,
and that from
um,
that, it's a good thing, I guess.
very good. No, it's very good. So the last question, you said that there's a clinical practice on site, a dentistry practice or a
Yes,
surgery practice.
yes,
What is the flow of people, of patients who are obviously not trained,
right.
and how are they segregated from the research areas, I suppose?
Well, currently at 245 First Street, the dental clinic and the clinical research center are in the same area on the 17th floor at 245 First Street. And the science building is across an atrium with car code access up to the floors that we currently hold on 4, 5, and 6. At 100 Chestnut, the dental clinic is on the first floor, just to the left of the entrance. So they have to go through security and then they'd be on the first floor. They would never have any reason to be up to the fourth floor, nor would they be given access to it.
Great. All right. Thank you very much.
You're very welcome.
Any other questions from committee members right now? I have a couple. Oh, Alex, go ahead.
Just a quick question. I was just wondering, just roughly how many bench scientists are working there versus,
I can get you the breakdown of numbers between, those people who are working, bench side versus clinically. But I would say we'd probably have close to 70 or so between techs, PIs, postdocs.
okay, that's fine. Thank you.
Um, I noticed that in the application you had a workers' compensation insurance affidavit.
Yes,
The permit is looking for a certificate of liability insurance. Would you be able to provide an updated
certainly.
certificate of and also list the city of Somerville on that as well?
Okay.
Just want to make sure that's on file.
So you want a certificate of liability
Perfect.
and name, city of Somerville?
the city of Somerville, and listing the Highland Ave address, which is 93 Highland.
Yeah, I can take care of that tomorrow with our finance group.
Perfect. Thank you, Kathy. I know we had mentioned training programs a couple times. How often are staff refreshed on those? And then are there any opportunities that you provide from potential, third-party groups about, other types of trainings and safety measures, anything like that?
Well, there are many different trainings because of being a research center and we're grant funded. And so there are all kinds of trainings in ethics and research. And we have an entire series on that that the scientists and postdocs are required to attend. We have HIPAA compliance, conflict of interest trainings that go across, and those have to be done and repeated on an annual basis. I meet with everyone as new when they first come in, and then we do annual trainings. And once a month, we have a staff council, and I have about 15 to 20 minutes if I need it for any safety updates, issues that need to be addressed sort of across the board from, wearing your badge to basically any issues or concerns or reminders for the laboratories. Especially. And then I do an annual training with each sort of individual lab group that's very tailored to what they do. And it's a very hands-on kind of more of a workshop that allows them to also have discussion and talk about processes. And then there are required trainings, obviously, and regular trainings if they work with animals and on down the line.
Thank you, Kathy. One more question. Um, have you met with the city's Office of Emergency Management yet? Have you been in contact with them at all?
No,
Okay.
I,
That's something that we can help facilitate.
oh,
We're trying to
great.
get the Office of Emergency Management involved in the biotech side of things and actually have them
Okay.
serve in the committee as well. So I just wanted to see if they had reached out at all.
Yeah,
I didn't.
we also hold a Department of Public Health clinic license for our Forsyth Faculty Associates dental practice. And so we hold a public safety certificate as well from DPH.
Good, good. There's one more question. I'm sorry, I forgot. This is a question from our OSPC representative, Rachel Ned Carney. She wanted to ask, are there any safety procedures from the Cambridge facility that are challenging to operationalize in the new space? And conversely, could you describe in ways in which you have been able to make improvements to their established procedures because of the new building? Just I think she wants to highlight the differences and compare, those older buildings in Cambridge to the new ones. Has it improved safety measures and operations, or are there certain challenges that they're putting up?
Well, I think when we moved to 245 First Street, we built out the labs. So they were actually gutted and we were able to um, build new laboratory space. But obviously, anything that can enhance safety as well as, looking at flow of operations is something that we've always tried to improve on. And so that was important in the design at 100. So we have ample space, for instance, for the bio waste boxes so that they are in a segregated area. Everybody knows where they are and doesn't take up a lot of space. And for those of you who have worked in science and worked in laboratories, sometimes people want to put a lot of things around, and we need to make sure we have appropriate egress, as well as just general safety for everyone involved. So I think, and also really designing the rooms for our biosafety cabinets. And we added additional fume hoods from what we had before. So we did expand a lot of the equipment as it relates to safety as well.
Great. Thank you, Kathy, for that answer. Do any of our community members have any questions that you'd like to ask? You can emote with the hand raise or put it in the chat if there's anything you would like to bring up. All right. Seeing none. And if you do, feel free to put them in the chat or email me after. I know both of you have my, oh, all right. Slavak, you are able to unmute if you'd like. There you go.
Okay, you hear me?
Yes.
Yeah. Okay. So since you guys working with the oral pathogen, I have the quick question. Do you have any specific, because I know that the lab will be BSL2, but
Right.
do you have any specific area to work with the microorganisms? Like someone is using you will do this on the bench, or you are using like air hood, and this air hood is only for the pathogens like microbes, or people use for cell culture or whatever different work, or is just for the microbiome?
It depends upon which hood and which group, because of what protocols they're actually doing and working on. And so I think to understand your question, we do cell cultures. We also work with oral bacteria, as well as cells. And it could be that they would both maybe be done in the same hood, but we have a strong aseptic program that they're supposed to be following with SOPs between uses.
Yeah, but
So they're
if you mix these two
contaminated.
things together, that is very high probability
Yeah,
that
yeah,
can be
you
through
really want to keep it
contamination.
apart.
Yes,
Yeah.
and the same question, because you guys do some animal stuff, and probably you collect the specimens from the animals.
Yeah.
So you have any specific area for, like, because you will fix this anyway, you will fix this with formalin, or you will do this with paraformaldehyde, PFA.
Right.
So do you have any specific area for this, or no?
Well, we have, obviously with an animal facility, we have biosafety cabinets, but we keep obviously all animals in there.
Yeah, I
But
know.
our tissues that, as you know, do need to come out and have work done in the labs, but in many cases, those are fixed tissues. But they could be, we don't have one single designated area that is for all of the PIs to use.
Yeah, and if you need to do any perfusion or something, you can do this in the animal facility.
Yeah.
Yes, that is
Yes, and the new
like
animal
surgery room or operating room, whatever is this. Yeah.
Yes, yeah, we have surgery rooms, and so yes,
Okay.
and BL2 rooms in the
And
animal facility itself.
And the last question, probably, because I'm going also through the IBC committee often, and the question is, if you work with pathogens, bacterial pathogens, there is no chance that you can create aerosols, yes?
Can you repeat the question so I understand it?
If you use the bacteria, pathogen bacteria, there is no chance that you can create aerosols. You know, like the spray or something like this.
Yeah,
that
we wouldn't
in-house.
be doing anything, because obviously if somebody's using anything such as a centrifuge, it's all sealed at
Okay,
that point.
okay.
But and anything that would have a potential for any bioaerosols needs to be done in the hood, and that's clearly outlined in their protocols.
That's okay. Thank you.
Francine, go ahead.
So I just want to clarify based on terminology. You specifically mentioned biosafety cabinets for your animal facility, but you've
Yes.
kind of switched between the term hood.
Well,
the
I
lab,
used
and I wanna
hoods
make
in a
sure that-
general term. I'm sorry.
Yeah.
No, these are
Okay.
biosafety cabinets. We have 5 biosafety cabinets, and then we'll have the biosafety cabinet when the vivarium is completed, and we have 14 fume hoods.
All right. I just wanted to make sure that
Yeah, sorry.
specifying.
Right. Any other questions, comments, concerns? All right. I think we're all set.
I'm happy to take any questions after, so.
Excellent. I'll be sure to forward this on to you and Debbie, Kathy. So
Thank you for your time.
yeah, thank you both as well. Really appreciate it. So now I'd like to move to vote for the approval, while marking as complete, and approval with conditions that the COI be provided. Do I have a second?
Second.
Seeing a couple, we'll go ahead and call the vote. Sorry, I just got to get my handy dandy voting notebook out, and we'll be ready to go. All right. Francine Rogers,
Aye.
Michael Swickus,
Aye.
Tim Bakey,
Aye.
Alex Vera,
All right, I have to abstain.
abstain. And then Colin Ziegler, aye. All right. With 4 ayes and 1 abstention, that passes. Kathy and Debbie, you'll be notified when the COI is provided. I mark it as complete and approved. You'll then be able to pay the fee. When the fee is paid, you'll receive your permit in PDF format, and you can print it on 8.5 by 11 to post in the lab. Yeah, thank you again for both of your times. Really appreciate it.
Thank you, and
Yeah.
we're happy to be in Somerville. Stop
Yes.
by and see us.
And
There you go.
I just want to add that I think Somerville should be happy to have you as well.
I
I think it's a
agree.
great addition for the city.
Thank
Thank
you.
you.
Thank you again.
Thank you very much.
All right, so that was excellent. This is great. We have new folks joining us, doing some really exciting work in the city at that fantastic building at 100 Chestnut. I just wanted to quickly mention to committee members, if any of you want to go visit 100 Chestnut, we have a good relationship with Ultragenics over there as well. They're more than happy to give us a tour and talk about the facility and what's going on. They're happy to do so. So if you'd like to, I can reach out to those folks and we can set something up. Just wanted to quickly mention that. So now I'd like to move to item number 2, which is a presentation from Hatch.bio on proposed changes to operations related to an animal care facility. Do I have a second? All right, seeing
Second.
awesome. We have 2 representatives. We have Joy Sinirvas Vargas. I hope I didn't butcher that too poorly.
You did good.
And then Thomas Swain, who is also here to discuss a little bit about the changes that are being proposed and also do a quick presentation for us and answer questions. So Joy, Thomas, the floor is yours. You should be able to, hold on, let me make you both co-host. You are now both able to share screen.
I'm here to answer questions in the event that Joy needs a little bit of help. But really, she's the star of this show.
Well, thank you for the introduction, Thomas. I'll just jump right in. Hi, guys. I'm Joy. I'm the site manager at Hatch.bio Labs, and we are also located at 100 Chestnut in Somerville. And ADA Forsyth is our wonderful neighbor upstairs. We presented last year as we opened our laboratory facility in August of last year, but we're in the process of expanding our space into animal care facility. So that is what this update and amendment is for. So I'm just going to quickly present a brief update as to what we've changed since our last permit conversation. So we at Hatch.bio, we actually started in Cambridge in 2017. We are a biotech incubator space that provides laboratory and office space, as well as a bunch of services and amenities for the biotech community, small as well as medium-sized companies. We are a privately funded company that is working on revolutionizing biotechnology and life science companies. To be able to provide, to be able to house these kinds of companies, we do need our DNA and biological research, which is why biosafety permitting is so important. So as mentioned, the whole, we are currently permitted for our laboratory space at 100 Chestnut, but we are adding an extra 9,000 square feet into the floor plan, which is essentially the animal care facility that we will be offering to our resident companies. Just to give you an overall layout of the facility. So we are on the 3rd floor of 100 Chestnut, and we have about 40,000 square foot of office and laboratory space. Total laboratory space that we have is about 19,000 square feet. And again, as we're mentioned, we are expanding into 9,500 square feet into the animal facility. Right now, all of our labs as well as our office is controlled by badge access. There is security in the 1st floor, so only authorized personnel can be upstairs. But in terms of the animal facility, the only caveat is the people that will be there not only undergo the Hatch safety training, but they will also have to go through animal care facility safety training, which I will go through later on the presentation, kind of detailing all of the different trainings that people will have to undergo before having access to the animal care facility. And I want to also point out that no visitors or other personnel are escorted through the laboratories or the animal care facility. Just to quickly brush everybody up on our laboratory facilities at 100 Chestnut. So essentially we have 8 laboratory suites, all in different sizes. Each laboratory suite has a support room. We are currently permitted for Biosafety 2 on the lab space with with abilities to work with Biosafety 2 plus in our tissue support rooms. We also have a shared cold storage room where we have -20, -80, and 4C fridge, as well as cryotank storage, as well as shared waste rooms, which include, it's segregated for biological and chemical waste accumulation. In our animal facility floor plan, we are essentially going to have shared and private holding rooms, rodent holding rooms. We will have shared procedure rooms, which will be essentially where most of the technical work of animal technical work will be done. We also have a dedicated room for food and bedding storage, as well as a dedicated room for solid waste and biological material. The whole building is pH neutralized and is maintained by our landlord, and all of the labs are negative pressure relative to the office area, with the TC lab being the most negative pressure. So this was the floor plan that we had presented last time. So all of the blue highlighted are our private lab space, and the red boxes are our tissue culture suites in those private lab suites. And we are just expanding a little bit to the right of this floor plan, and this space is essentially the expansion of our animal care facility at 100 Chestnut. Just to go over the shared amenities that I just discussed that we offer. So we do have cold storage, autoclave, as well as glass washing capabilities on our floor. The Hatch.bio team manages all biological and chemical waste for all of our resident companies, as well as having shared tissue culture and microscopy rooms. So as I mentioned, just going to quickly go over the vivarium, the animal care facility in a little bit more detail. So overall, we will have 5 holding rooms. These 5 holding rooms will again hold rodent models, so no more than rats. Right now, it would basically be mostly mouse. Within each holding room, there is a procedure room, but they will only be able it's only for transporting like materials. It's not to do any kind of technical work in those rooms. We do have shared procedure rooms dedicated only to be able to doing that technical work. And we also have, again, food storage, soil material storage, and 2 airlocks for entrances into the facility. So our standard labs are all Biosafety 2 with Biosafety 2 Plus in our support rooms. Again, Biosafety 2 is important when working with those established human cell lines, as well as working with those primary human cells and tissue and blood lines. So since the animal care facility will have animals infected with biological material, may be deemed as animal Biosafety 2. Again, just like our labs, all of the rooms are negative pressure within the rooms. All of the work will be conducted in biosafety cabinets and/or animal transfer stations. Right now, we have allotted a biosafety cabinet in each of the holding room with a spare animal transfer station in case it's needed. We also have hand washing sink in all of the procedure rooms, as well as having our spaces routinely decontaminated on a quarterly basis. In terms of biological waste procedures, all of our waste is treated and disposed of according to the Massachusetts Sanitary Code. Stericycle is our solid waste vendor, and they are in charge of removing all of our solid as well as sharps and solid biological materials. All of the waste are double bagged in Stericycle boxes and then moved into our waste room and until pickup from Stericycle. All of the waste are not transported on the floor. They are all on dollies, so there's never a time where the waste will be dragged on throughout the floor. Same in the animal care facility. It's a little bit different. We will be generating animal waste, so tissue waste. So essentially that waste will be stored in a freezer until the day of removal from Stericycle. So as mentioned in the floor plan, we have a dedicated room where we will be storing all of these materials. We will have a fridge in there to be able to store those materials. And then on the day of pickup, we will move them to the main accumulation area for Stericycle to pick up. And one more thing, we will also make sure to label the boxes for incineration when we dispose of them. And just want to quickly touch base on liquid waste, liquid biological waste. Our standard procedure on disinfecting liquid biological waste is to dilute it with 10% bleach for a minimum of 30-minute contact time, and then prior to disposal in the sink. And we expect and we train all of our companies to make the bleach solution daily. In terms of the workflow of clean and dirty workflow into our space, I just want to quickly go over this. So in this floor plan, the star right here is essentially the entrance to the animal facility. So it essentially brings out into this corridor, which is going to be both clean and dirty. But once the animals hit that airlock located here, that is considered clean area. So essentially the animals will be cleaned out and then moved to their holding rooms in the facility. So we have 1, 2, 3, 4, 5 holding rooms. So essentially it's a big box, and once the animals once the waste, to remove the waste, essentially we would be still coming out of the same corridor, but out in that main clean and dirty corridor to remove the waste from the facility. I want to quickly just touch base on badge access. So we are going to have a badge access at every single door of this facility, and that's what all of these red dots on this floor plan are, as well as having a plan of having 3 cameras just to be able to see the flow of animals throughout the space. So these work practices that are currently in our safety protocols and being followed by all of our resident companies. And I'll go over everything with the caveats of what we'll be adding as we open up the animal care facility. So all of our, as mentioned, we have biosafety cabinets in all of our lab support rooms to be able to work with those kinds of biological material. And we have a decontamination or a disinfection procedure at the end of each work shift that we train all of our resident companies on when they start at our facility. Training for our labs are required for new employees and conducted annually thereafter. With the access to the animal care facility, training is required and will be conducted initially as well as annually, going over all of the topics that I will go through in a couple of slides. Veolia is our chemical waste vendor, and they are 24-hour emergency response contact. We use Cambridge Health Alliance as our medical surveillance and occupational health center. We have door signs and labels on all of our doors, as well as the plan to have it in the animal care facility. Again, waste is treated and disposed of according to the Massachusetts Sanitary Code, and we do hold an IBC at Hatch.bio, which we do initially if companies are working with those kinds of materials, as well as on an annual basis, to be able to make sure that we have the right protocols and safety procedures in place. In terms of permits, we already hold the biosafety permit for our main space. We're asking to extend it to our animal care facility. The wastewater permits are handled by our landlords. We're currently amending it to increase the volumes at which we can store on our facility. We are a very small quantity generator, and we are currently in the process of getting a DEA license for the substances that we may house in the animal care facility. We are also in the process of working on our animal care facility manual and plan to have all of the biosafety cabinets certified once the construction is completed and the cabinets in place. Tom, do you want to say something?
Yeah, I was going to jump in really quickly. As many of you probably know, the DEA registration, you can't really get it until you've acquired the substance registration through the DPH. Also, something to be said that these are usually held by the research. The DEA registration is usually held by the researcher who's conducting the work, And so as people come in and people are going to be expected to have their own registration as well, it is very much on us to ensure that we have that Hatch.bio has the facilities to accommodate that. And that sometimes that would mean a means of a lockbox and a way of keeping any kind of drugs that these companies were to come on site and need or use, adequate space to lock them away. And that's what the cameras are for on one of the previous slides. I wanted to jump in on that. My apologies, Joy. The floor
No,
is
thank
yours.
you. No worries. Thank you. That's a good point to bring up, so I appreciate it. So just want to go over the vendors that we use. So as I mentioned, all of our sharps and biohazard waste is handled by Stericycle. We use Waltham Pest Control for our pest services. Universe is our lab coat vendor. Cambridge Health Alliance is our medical surveillance program. We use Veolia for our chemical hazardous waste. All of our certifications on biosafety and fume hoods are done by Alert Scientific. We use Safety Partners as our safety consultant, and we plan on using Charles River for animal husbandry and IACUC compliance support in our animal care facility. So this is the main slide that I kind of want to go through. So we already cover the first three trainings as part of the Hatch safety program, which includes the emergency action plan, which just generally goes over the safety, the overall safety procedures we have in place, biological safety as well as bloodborne pathogen for any lab users, but particularly as well as any office, essentially any person that gets into the facility. But lab standard is mostly for lab personnel. And all of these trainings are done initially during hire and then annually as well. In terms of the animal care facility, we require all of these trainings to be complete before they have access to the facility, which will include vivarium access requirements, IACUC protocol process, EHS policies, working with research animals, biosecurity, and the use of equipment and supplies. As mentioned, we do contract safety partners to help with additional support. So Thomas here is my safety consultant who is helping me throughout this process to kind of help set up the animal care facility in compliance with all of the regulations and federal, state, and local regulations. And that is all I have for you guys. I'm happy to take any questions that you may have.
Thank you, Joy. Thank you, Thomas. Really appreciate that in-depth review as to the update, to the permit. I want to open it up to committee members. If you have any questions, comments, concerns. Actually, Michael, go ahead.
Just to be clear, there's no plans for anything other than rodents, rats
Yes.
and just rats and mice.
That's rats and mice. Yeah.
I had a quick question. You're sourcing the animals from Charles River, is that correct? Okay.
Correct.
And
So
then,
we will, mhm.
yeah, go ahead. Go ahead, Joy. Sorry to cut you off.
Yep. So yeah, there will be there's a whole vetting process Charles River already has for their animal receiving. So there are three vendors that they use. So Charles River, Jack's Laboratories, and I believe it's Taconic is the third vendor, but I'm happy to send over the three vendors that we would probably use for animals.
Okay, I'm just double checking because we will get questions. Of
Sure.
course, this is a hot topic right now. Michael, go ahead.
Yeah. So I'll ask the same question that I asked before. Because you have so many different companies in, do you have issues with compliance
That's a great
around
question.
safety?
Yeah, so we, as Kathy said, the compliance, it ends up being like, please wear your lab coat as well as safety glasses. We've never had major compliance issues where like, there's been like serious like things we've had to address. So in terms of compliance, all of our companies are really good about going through our training, making sure all of the requirements that we have before they enter the lab is complete, as well as doing the annual training as well.
Thank you.
Yeah, thank you, Michael. Thank you, Joy. Quick question. With your emergency response and safety manuals, what sort of changes are going to be implemented for things like escapes or anything like that involving animals? Any major changes to protocols or challenges that you foresee?
I could cover that one. In terms of changes to the manuals, it's really going to be the inclusion of references to new manuals, and in terms of the emergency action plan and that, it's going to be more along the lines of the directional, really harping the directional flow of the facility, because of course, with badge access for every door, if people do need to evacuate, they need to understand that in procedures like those, they would go a certain way. Outside of the facility, of course, it's look up, see where an exit sign is, but that's not exactly going to be the case in the new facility. And that's where primarily most of it's going to be. The same way that we tell people not to prioritize their research outside of an animal care facility, the same will go within the animal care facility, with the exception of don't just throw your animals around if you have to escape. It is, of course, you have cages, you have a procedure, you have a room with security, and to make sure that your animal is secured before you evacuate. Of course, you prioritize your own life, but that's the major changes to the emergency action plan.
Great. Thank you. Any other questions? Francine?
So kind of tailgating on Colin's question, what about your escaping and potentially escaping animals? How is that being added in since, I mean, I'm assuming, you'll have a new manual kind of dealing.
Yeah, there's going to be an animal
specifically
care
with this,
facility manual.
I mean, is there our thought on how you're going to be addressing that?
Yeah, so if there is any kind of escape or exposure, very similar protocols we put into place where we'd have to, what's the word I'm looking for? We'd have to notify you all. I also know that it's definitely based off of what the mouse was exposed to, because then you start opening up the gates to other forms for them. They're kind of escaping me. They're usually referenced in the manual. I'd be more than happy to supply you with the animal care facility manual once it's complete, because I, for the life of me, cannot remember the names of the forms that you complete when there's an infectious disease exposure. But that would be a big change, would be the knowing what the companies would be bringing to the table, what they'd be bringing into the facility. And that means if something were to escape, what would be the exposure risk? And so what kind of documentation would have to be sent forward to the state and federal in the event.
The nurse's test would definitely be something that,
Yeah.
for the not naive, that our committee would definitely be very concerned about.
Yes. Of course, you'd be some of the first people that we'd reach out to, because we have direct contact with you all. Some facilities or some organizations have dedicated forms that they'd have us fill out. Definitely at the federal level when there's kind of exposures, depending on what the mouse is. You know this, depending on what the mouse is being exposed to.
Great.
I hope
yeah.
I can. So sorry, I can offer the manual once it's complete, but I hope for right now that I give you some closure that there are plans for escapees.
Great. Well, thank you, Thomas. Appreciate that. And that was sort of I was leading the question of, or the comment of, when the renewal comes up, how significant are the differences going to be in the application? And we'd like to see certain things reflected when that renewal does come up. But we appreciate you both notifying us ahead of time and explaining what's coming through. So when we see this and we look at the IBC report and we look at the changes in the manuals, we're not taken aback so far. It's like, what, they have an animal care facility?
Yeah, that's what I was thinking when I originally reached out to you.
Again, I feel as though this is the sort of purpose of the meeting, and we just want to ensure clarity. So when we do get that renewal, we'll all be on the same page.
Awesome.
Great. Any additional questions? Tim, Alex, Michael, also community members, Slavek, Ranjan, any questions? Kathy's still here. Kathy has any questions? Oh, she's muted. You're muted though, Kathy. Hold on.
I was saying to Joy that we'll have to connect since we're neighbors.
Absolutely.
Oh, good. I'm glad everyone's connecting. So for now, there's no voting item on this current topic, but when the permit does come up for renewal, there of course will be another discussion internally within the committee, and then on my end in terms of approving and submitting it. So again, Joy and Thomas, I really appreciate you all doing this well ahead of time before renewal comes up. We truly appreciate it, and we'll be in contact about requesting documentation and updates as committee members come up with additional questions, or I have them on my end on the permitting side.
Awesome. Sounds good.
Thank you.
All right. Thank you both. Really appreciate your time.
Thank you.
Thank you all.
Great. Awesome. We're learning so much today. I love this. This is why I love this committee. It's my favorite committee. You all are on my favorite committee. So thank you. So now
I'm
I'd
sure
like
you
to
say
move.
that to all the committees, Colin.
I also have the rodent committee, which is they're not always nice to me, but that's okay. I can take it. It's fine. I'd like to move to item number 3, which is realigning the current changes to the January-March renewal timeframe. That wasn't very clear on the agenda. Apologies for that. I've spoken with our admin team at ISD who deal with all sorts of permits, and we've been trying to find a way to get everyone back within this block to make it easier on this committee for review and scheduling meetings and everything. It's kind of difficult to convene everyone so sporadically when these sort of complicated topics and permits are coming in all at different times. Oh, thank you, Joy. Really appreciate it. All at these different times. So to condense it into one set time period of the year, similar to how food permits and dumpster permits and every other type of permit you can imagine in the city, this would be much more efficient for us. The best path forward that they proposed to me was essentially to let the current permits stay as is and let them roll into January 2026 and then open up for renewal for the January through March time period and then have them pay that renewal fee then to get a 2026 through 27. So essentially the city would be missing out on the permit fee for a little bit, but then we're not double charging people by having them reapply now, if that makes sense. That was the best path forward that was proposed to me. I just wanted to discuss it a little bit here so you are all aware because it has implications on your time and how we structure these going forward. But any other thoughts, comments, questions about that? No? Does it sound like a good idea? Yeah. Yeah. I don't want to be calling you guys in June and then July and August and September and then, oh, is this an approved one? Is this complete? Bouncing around like that. Just doesn't make much sense for everyone's time. So yeah, I'm gonna go ahead and talk to the ISD admin staff and go ahead with those changes, and I'll keep everyone updated if there's any problems. Okay. Perfect. I'd like to move to our final item. It's a very short one. Francine had mentioned it to me. Discussing the redefinition of BSL2 plus. I think the plus is the big question. We've gotten questions about what that exactly means, and it is throughout our policies and procedures as well as in the ordinance. So it would be very simple of just amending the plus to enhanced and then describing some of the key characteristics of what BSL2 enhanced encompasses to the physical space and as well to operations for facilities. So, Francine, I'm going to go ahead and let you take the floor so I'm not rambling on and on and on about this, but if you want to go ahead and discuss.
All right, so background on, I think we're probably all familiar with constraints or like the requirements that we see for a BL2 or a BSL2, depending on, NIH versus CDC nomenclature. And then there was a period, longer time ago, many decades, where they added the plus to basically indicate additional practices would be in place, but that lost its favor because people would say, well, if I have a plus situation here, what would be a 2- situation? So with the kind of the major professional organization that we have if you're thinking in the US, which is, ABSAR International, which is American Biological Safety Association, they have moved to using enhanced so that you're dictating or mentioning that we have a BL2 space, but I'm using additional practices. So I'm enhancing my BL2 space with additional potentially 3 type practices so that you're not indicating that there's going to be a way to detract from that. You're either going to be a 2 or you could be a 2 and enhanced, but there wouldn't be anything kind of below that. So it's not like you would have a 1+ or 2- situation. So I had asked Colin if we were sold specifically on calling it 2+, since the more common terminology is 2 enhanced now.
And I'm tending to agree because I've also gotten this question from the community and from people applying for permits. So, yes. Does anyone have any objections to me going through and doing a quick control find and replace? Okay. All right. I love amending ordinances. This is my favorite stuff. So, well, thank you, Francine, for that feedback. I really appreciate it. It's very helpful. With that, that is all I have for agenda items today. I would like to move to conclude. Do I have a second? All right, seeing some seconds, I will go ahead and call vote for conclusion. Francine? Tim?
Yep.
Michael?
Aye.
Alex?
Yes.
And Colin, yes. Well, thank you all. Really appreciate your time. I'm going to go ahead and stop the recording. You can find it online at your nearest convenience. Thanks so much.